right. Well, welcome everybody. Thank you so much for being here. Welcome to 2021. Hopefully it'll be better to us in 2020, but signs are, as the Magic 8 Ball would say, you know, signs are mixed or whatever. The outlook is uncertain. But we are hopeful that working together, we can get through some of the difficulties that we're all facing. And that's why we're, again, going back to our theme of gratitude, I'm grateful that we have this technology to be able to come together and share what we know, share what we're going through, network and ask questions of each other and get resources that can help us all do our job. Just in case folks are jumping on now, if you could just put your name and position and where you work in the chat for the purpose of taking attendance, I would appreciate that. My name is Mike Jackman. I am the District Director for Congressman Bill Keating and also the Chair of South Shore Community Partners in Prevention. So I'm glad that we're all here today. We're up to about 25 people. That's great. We do have a great speaker today, and we have a report from a mini grant outcome kind of related to what we were just talking about. So I'm really looking forward to both of those. But before we do that, I did want to make sure that we take care of business, and usually that means approving the minutes for our December meeting, just so we're on the up and up, as it were. So Kim did send around the meeting minutes. Thank you, Kim. If anyone wants to make a motion to approve the minutes from December, they can just raise their hand or unmute themselves or whatever they want to do. Deb Shepperly makes a motion. Is there a second? Okay, Catherine, thank you. And any discussion on the motion? All those in favor? Okay, opposed? Motion carries, thank you. Yeah, any discussion, and I'll make sure I mute everyone so we can't have any discussion on the motion. That's how we roll. That's how we roll in this CHNA. Anyway, thank you all so much again for being here. Our mission is to improve the health outcomes for people in our region. And one of the ways we do that is to share resources, especially financial resources that we get through the determination of need process from our healthcare facilities, including the hospitals, South Shore Hospital, BID Plymouth, Leahy. Did I get them all, Deb? I can never remember all the names now. But the DON process, we do have resources to share, and we do that through our grant program. And we have grants. We have a mini grant up to $3,500. We have a health literacy grant up to $10,000, and a overcoming barriers to health grant, also $10,000, and a behavioral health grant up to $25,000. All that information is available on our website, which is chna23.org. So I urge you all to check out the website, check out our Facebook page, where a lot of these resources are available as well. But when we give out grants, we ask that our grantees come back and tell us what they did with that money. So we are happy today to have a mini grant report from Katie Mappa, who is a clinical advocate for the United Way Family Center. And Katie's going to tell us about her mini grant. Good morning, Katie.
Thanks, Mike. So I've got with me Katie Rayner, who is our project coordinator for our health literacy grant project, and Ashley Silver, who is a social work student at BSU doing her internship with us this year, and she's been helping us roll this out. So the three of us are going to be presenting this morning. I have a short PowerPoint. Though if you've ever done a training with me, you know I tend to go overboard on the PowerPoint. So hopefully it's as short as I think it is. All right. Everybody see that? Great. So we launched the Plymouth County Resiliency Library with the goal of connecting kids and families to digital health literacy resources. And we'll talk a little bit about the launch. It went live in November, but our goal was to create a lending library to provide kids and families with books that talk about behavioral health, trauma, coping skills, and resilience. Our hope was really to reduce stigma and silence around different adverse childhood experiences. And my role, I run the direct service part of our program that connects kids and families impacted by substance use to community-based services. And so behavioral health was a big piece of this for me. And really wanting to promote conversation and discussion among children, families, and community members for these topics. And our inspiration, I know we were just talking about the Hey Kiddo event that we had last night that was great. This book it's a graphic memoir. Jen Cantwell presented last month about Marshfield doing a project around this book. We love it, we think it's great. And of course, Sarah Cloud has written her Mama Paca book with a new one in the series coming out soon. And To the Moon and Back has Sam the Superhero. These books were kind of our inspiration. We love them. We think more kids should be reading them. And so as we were thinking about distributing these books, we were also wondering how to continue to get these books into the hands of kids and families. So some of the partners that have made this possible for us, the United Way with our DEC grant, we're big on partnerships. And so Sarah at BID, Kelly at PYDC, and then our PCO team have helped us kind of pull this together. Lots of people have helped publicize it and get it out there, but we wanted to highlight a few of them. And then COVID hit. So we wrote for this grant about November of last year. It got awarded for January. And it initially really thought we were going to do a physical copy of books. People would come into the family center, they would take out a book, leave their information, bring it back, do a little survey on how it went. And we would have like little totes of books in the family center that people could come get. We would bring them to events, we would have them available. And when things sort of shut down in March, we decided to make the switch to a digital platform instead, which comes with a lot of really great perks. We'll talk a little bit. We partnered with Overdrive, and Katie will get into some of the specifics of that partnership. But it meant that we were able to have a lot more titles available than we had initially written the grant for. It means that as we build out that platform, we'll have access to books in languages other than English. We don't yet, but that's something we're working toward. And it also means we don't lose books. So having paper books that you're handing to a family, you just don't know if that's going to come back to you. So we had kind of written into our grant that we would be replacing books. But with this switch to a digital platform, we really don't have to do that. The downside is that we lost access to some books. If they don't have an ebook or an audiobook version, often if they're self-published, then Overdrive does not have access to them. And so the very books that we put up as our inspiration are some of the books we don't have access to on this platform. So we're still working through having paper copies of those at the Family Center to give out, but really promoting the digital platform for families to check out other topics as well. So we gained a lot. We also lost some of what we were planning to do with this, but overall, we've been really happy with the way that this has turned out. I'm going to pass it over to Katie Rayner, our project coordinator, and she's going to take it from here.
Good morning, everybody. So as Katie had said, we switched to a digital platform once COVID hit. So Overdrive is a digital library platform. A lot of Plymouth County public libraries use it as well. So we contracted with them, and then with the help of our partners such as the DA's office, the public schools in Plymouth County, PCO, and To the Moon and Back, we were able to get a lot of book recommendations, and a lot of them were on Overdrive, as Katie explained. So that was really helpful for us to get feedback from those in the community. And then we just brainstormed a name, which we came up with the Plymouth County Resiliency Library, but also the Book Buddy Project, which was created by a family member, Family Center staff's daughter, which was great. And then Katie was able to meet with Overdrive as well and purchase the books, which allowed us to set up the library through Overdrive. So we launched on November 16th. We had 18 signups the first week, which was awesome. We've been posting on the social media platforms, trying to get more people in the community to sign up. And we've had a lot of community providers in the county and surrounding counties sign up for the project as well. And we've been active trying to get more people in the community involved. So far, just some data. We have 131 books available in the digital version. We have 11 audio books available, and I'm pretty sure Hey Kiddo is one of the audio books that we have available. We have 45 accounts signed up right now and 65 users, which also have their children as well, being able to access the books as well. We've only had 14 users log in so far and only 14 checkouts, but it is primarily new. It's only been out for about 2 months, so we're hoping to see those numbers go up. The participants from the towns of Plymouth, Pembroke, Marshfield, and Duxbury as well. These are just some of the names of the books that we have that we were recommended to us from partners in the community. And then for the future plans, it is a 3-year contract. So we're in the first year right now and we have purchased the books for the first year. And as I said, we've gotten a lot of community members, community providers involved. So we're hoping to market it more towards families and school librarians and educators to try to get more children involved and get it more into the classroom and the school so that they can access it as well. And then budgeting out for more books as we get more recommendations or see a gap that needs to be filled with certain topics. Katie mentioned that there's a language capacity available on Overdrive. So if we see a need for different languages on Overdrive that users are requesting, we can add that as well.
And I just want to jump in and talk about the Book Buddy program. So Katie mentioned that we named it the Plymouth County Resiliency Library, but really for kids, we're hoping to market it as the Book Buddy program. It's a little bit more kid friendly. And the idea being, you know, if you're going through something hard, there's a character in a book who can be your buddy through it. That there's somebody going through something similar and you can learn along with them. So we're gonna, in the future, be marketing that a little bit more heavily toward families. And then Ashley.
Good morning. So I'm just going to talk about a little bit how you use the library. So on our promotional materials, we had put a link to this website, which we were able to get a page up on the United Way website.
Which I'm going to pull up for us. Wrong one.
So if you follow that link, it takes you to this web form. And then as you scroll down, it's a little bit a blurb about explanatory, like the library and what it's for. And then we're collecting a little bit of demographic information, names and emails and what town, and then users, so we'll be able to gauge whether kids are using it. And then languages spoken at home, so we can identify needs for certain languages in our books. And then we wanted to see like if the adult was a parent or whether they were a community provider or worked within the schools. And then the kids and what schools and ages they fell into. And when you submit this form, we get an email on our admin email, and we're able to collect all of that information and sign them up for Overdrive, and then email them back with their login information and a link to the library, which you see above. And then once they're in, you can basically scroll through and there's different, excuse me, there's different, it automatically sets things up into like certain collections, and we're working on creating our own collections based on like theme and what have you. Yeah, we could definitely put that link in the chat for anyone who wants it. And then so you see like it says picture books or most popular, but we're going to go through and we're planning to do like book reviews and other things and sort of group them based on topic and things like that as we gain more materials and have more users. And then Overdrive has the website you can access obviously through the computer, but they also have an app. And then Libby is also an app by Overdrive that you can download on a smartphone or a tablet or other device to gain access to the libraries.
The one tricky thing about the apps that we found, so I use both of these with my public library. They were lifesavers when everything shut down for COVID. But on these apps, you search the library by name. So just United Way of Greater Plymouth County. If you start typing it in, it pops up immediately. But it can be a little tricky to figure out how to find the library on these apps. But we are available to help people walk through that.
Yeah, if people have questions, they can email send an email back to the email that sends them their login information. And it says that on the email that we sent with the login information. So we have gotten a couple questions and we're able to communicate with people and answer them.
Technology can always be a bit of a barrier. All right, so that is our presentation. Any questions? I have to look at the chat.
Yeah, thank you so much, Katie and Ashley. Kim has put the link to the library in the chat, so folks can register right there at that link. I actually had two questions.
Mm-hmm.
One, are you doing any sort of book clubs or book groups or guided discussions, or have you thought about that? I know it's tough with COVID and, obviously can't be in the same room, but just wondering if you've had any success or any thoughts about that.
Absolutely. So we have not done it yet. When we first spoke with Overdrive, one of the things that sort of pushed us in that direction was we can purchase books that have multiple users that can access them for a certain amount of time. So if anybody else uses the Boston Public Library's Overdrive, they have Lucky Day books where they have a whole bunch of licenses and you can grab it while it's on that. And so we've thought about, we're planning to, I guess is the long story there, figuring out which books have that kind of access and coming up with groups that would be interested in doing something like that. Yeah,
I definitely see that. It's great to make the books available to families, but I can see the families would want to have a more of a discussion with other people, guided by whether it's a counselor or whoever, just to kind of get as much value from reading as they could. And I guess my only other question would be, looking to the future, you talked about buying more books. Are you optimistic enough to foresee actually buying physical books and having people, come together and come to your center and get the books physically? So talk a little bit about that, if you would.
That is the hope eventually, especially where some of our favorites are not available on Overdrive. And so we have lots of copies of Hey Kiddo at the Family Center right now. We've got the DA's office just purchased a bunch of the Mama Paca and Sam the Superhero books to distribute at schools. And so we're looking for ways to do that. I think it'll take time, just with everything else with COVID, and once that's safe, being able to pass off a physical something.
Awesome. Thank you. Does anyone else have a question? You can unmute yourself or just raise your hand or put it in the chat, whichever you want to do.
I'm going to drop the flyer in the chat. Our ask is that you guys would help us promote this. And so help us particularly get it into the hands of parents and kids and families.
Yeah, I think it's great. I think it's been difficult, obviously. The end of the year and the holidays, that certainly didn't help either. And, not having as readily access to schools too, I think is probably a big challenge too. So yeah, folks can spread the word about it. I think that'd be a huge help, because we really want to see as many people as possible avail themselves of this resource. So that's great. All right. Oh, I see a question. Abby, do you have a question? Abigail?
I was just hoping that you could send me the flyer, because I'm the director of the school-based program and care management program for Gosnell. So we are all embedded in the Plymouth schools. So I would love to be able to distribute that to my clinicians to pass along to their families. That would be wonderful.
Absolutely.
Yeah.
Could Kim send that out along with the meeting notes and all that?
Yeah, I'd be glad to. Absolutely.
Thank you so much.
Great, thank you. Okay, well, again, Katie and Ashley, thank you so much. And we're really glad to see that you're meeting with some success, and we want to obviously support that as much as possible. So I'm very excited to be able to introduce our next speaker, who is the Vice President of Quality Management at South Shore Health. People who've been coming to these meetings have heard me say it, but it's important to reemphasize that our mission, part of our mission, as I said, is to improve health outcomes for residents in our region. But we've determined through our health assessments, comprehensive health assessments, that a way to do that is to reduce barriers to good health. And we have seen, and it's become especially clear with the coronavirus, that one of the obstacles to good health and barriers has been racial inequities and just unequal access to care, unequal outcomes. And it's really important to, as a group and as a community, to be looking at these barriers and doing what we can to overcome them. I would note that the President-elect's transition team focusing on COVID has a dedicated person who is, her mission is to look at health inequity and how care has been delivered, and testing and vaccine and all the different aspects of the COVID crisis. How has that resulted in the outcomes that we've seen where there have been racial inequities? And I'm really excited, speaking on behalf of the congressman, that the new administration will be looking specifically through that lens at COVID. So we really think that's important. It's important for us to address these issues, especially during COVID, but especially, not especially during COVID. It's always important to look at these inequities. So very excited to have you here today, Ben. Ben Asfaw is the Vice President, as I mentioned, of Quality Management of South Shore Health. And I'll turn it over to you, Ben. Thank you so much.
All right. Good morning. Can you all hear me?
Yep.
Yes? All right, perfect. So good morning. My name is Ben Asfaw. I'm the Vice President of Quality at South Shore Health. I've been at the organization for about 11 years or so, and I'm the executive lead of our healthcare equity committee, which was started recently. So let me pull up my presentation. Hopefully you can see it. And if I need to, oops, sorry, I just did that wrong. Hold on. Let me go here to share. Share screen. Okay. Can you guys see that?
Yes, we can.
All right, perfect. All right, I'm so used to working on WebEx, I really start to doubt myself with Zoom. Zoom is a new thing. Okay. All right, so trying to go into presentation mode. All right, perfect. All right. So what I'd like to discuss with you today is the equity as part of what we talked about in quality. Like I said, I'm the Vice President for South Shore Health Quality, and how this kind of aligns with the work that I do and my team does and what we're spreading across the system. How we started the Healthcare Equity Committee, and I think the introduction you did earlier kind of helped set the stage of the climate that we're in over the summer, and really just sort of, it really drove that, and it was work that actually started earlier than that, than the things that we saw over the summer. But the Healthcare Equity Committee wanted to go through that and talk about some of the guiding principles of what we're working on and some of the current activities, and go through some next steps. So the first part of it is just, and you may have seen slides like this before in terms of what we talk about in quality, or the elements of quality. And quality, this was defined by the Institute of Medicine back in 1999, and it came out in this, their book, Crossing the Quality Chasm, in 2001, that quality has these 6 elements, and the acronym is STEEP: safe, timely, equitable, efficient, equitable, effective, efficient, and patient-centered. And from the work that I do, a lot of information that we provide is always talking about pay for performance, pay for reporting, information we send to CMS, DPH, to private payers. We talk and cover many of the 5 other elements, but equitable is always something that we don't do enough of. And I think now there's more of a push, you're seeing, from the state and around the country and from the federal government, to really show how our care is truly equitably distributed. And what does it mean to be equitable? So this graphic, you may have seen graphics like this before. I really like this one. But the idea, the differentiating between what's equitable and what's equal. And the idea is that in the first image, if you gave everyone the same supports and standing all in the same box, that's equitable care. That's equal care. But equitable is that you give the supports that make sense for that individual, so everyone has the same opportunity. And the last graphic is then you take all the barriers out there. And what we wanted to do in the, what we wanted to do with the Healthcare Equity Committee was really look at how are we in 2 fronts. How are we delivering care to the community that's truly equitable, understanding healthcare disparities, and then also knowing that we can't help those unless we help ourselves, looking at how we improve our interrelationships with one another, and how do we identify inherent racism or bias that we have amongst each other. As great as South Shore Health is, it's not immune to any of these biases, as you are all aware, and so it's like having an opportunity to really talk about these issues amongst ourselves. What kind of got us kicked off, and I mentioned this earlier, is the events of the summer with George Floyd, Breonna Taylor, Ahmaud Jamal, and for those of you who follow news, those are just 3 incidents of a long line of incidents that have been happening for decades. So it just happened to be that with COVID, I think it was a tinderbox and it exploded. But these issues have continued, have happened for a while and continue on. And I won't go through the whole thing, but basically our past president, our interim president, Rose DiPietro, sent out a message to colleagues and staff, basically just for the first time really addressing any kind of social issues that we've had or a discussion, outside in front of the organization, which I just, was just really applauded and supported Rose in doing so. And so this idea of now is not the time to be silent and really trying to have people have a voice to have these discussions was which was great. And what ended up happening is that we had a lot of people just reach out to Rose and then also to myself to be a part of something bigger. And so I lead the Quality Council, which is our system-wide quality group. Under Quality Council, we grew the Healthcare Equity Committee. And so from there, we started to collect volunteers, people who want to be a part of something, people who wanted to really, help and get involved and understand what can South Shore Health do. I had alluded to earlier that we had started this work before, and back in January, there was a small group of us that got together to talk about really what kind of programs can we bring in, and in terms of educating our staff and really understanding how we work towards the community. We've always had community work, but really understanding how we do interpersonal relationships. When COVID happened, that kind of put that on hold for a moment, but then when the events of the summer happened, then it became, we addressed it again. So the next few slides I have are really just to talk about the formation of the Healthcare Equity Committee. Excuse me. So it's basically, at first it started off with 45 volunteers. We had representation from all across the organization. So South Shore Health is more than just the hospital, as many of you may know. It's the hospital, it's the VNA, it's the medical center, it is our ambulatory, our ambulance service, it's our urgent care program, it's our outpatient surgery. So it's a wide diaspora, a wide group of people coming in together. And then we had multidisciplines as well, people from all across the hospital in different departments. So it was fairly well, you know, probably more slanted more towards the hospital representation, since that's the largest group, but we had a fair representation across the system. And then within that group, we started going through and asking questions like, what do we need to do in terms of developing our own skill set for achieving health equity? So you can see here that some of the building blocks we identified is being having humility, being aware of our own biases, having empathy, improving communication. And the biggest one that came up amongst, again, this is the survey of the 45 or so, was our willingness to listen. And all these skills that you see aren't necessarily just for healthcare equity or diversity, equity, inclusion type of, this is just us being better colleagues to one another. So I think these are really good building blocks for us to identify and really just set forth ideas of how do we, you know, improve those skills with a nod towards looking towards healthcare equity, diversity, equity, inclusion. So we ultimately came up with having a few project recommendations. So we knew that we wanted to work on two fronts. So one, we want to work on our interpersonal skills, and two, we want to understand like how we as a health system interact with the community, and how do we really start to get into understanding healthcare disparities and equitable delivery of care, provider to patient, and then also colleague to colleague. We wanted to find a partnership with someone because we knew we didn't have the skill sets to do this on our own. None of us are trained or we didn't have that in-house expertise on diversity and equity and inclusion, so we knew we needed to find a partner. And so we're also hopeful to look for someone who was local, and we were able to do that with YW Boston, and I'll talk about more about them in a second. So for the Healthcare Equity Committee, being a project manager person, we did a charter, we did the scope, guideline, goals, and the whole nine. So I'll show you a little bit of that. But just to kind of give you an overview of what we're trying to do. And again, I just emphasize this is the first time as an organization that we're really trying to do this head on. So we took all the ideas and we kind of distilled it down to these basic concepts. We wanted to create a platform to address racism, discrimination, and inequality in healthcare. We wanted to identify education, training, and learning opportunities for our colleagues. One key thing being in healthcare, we always want to know about numbers and data. So we want to measure disparities and inequities. So we really want to be able to show and have data to prove to people, you know, the challenge that we're facing with our community. And we want to celebrate diversity and inclusion across our health system. In terms of guiding principles, kind of reiterating many of the things that I said before, but you know, we affirm that we are an organization of diverse backgrounds and opinions, and we want to celebrate that and really try to bring us together, really be comfortable to be able to express and have those discussions. As a healthcare organization, you know, racism, discrimination, inequality is unacceptable, and we need to be able to say that and have people just not just assume that that's the case, but we have to be outward and say that and really make the environment welcoming and really, you know, make it a safe space for all of our colleagues. So we want to cultivate an environment free of racism, discrimination, and inequality, not just for our employees, but for our patients and also for the community. So those are the guiding principles that we have. And I can pause now if you have questions, or should we take questions at the end of the
Yeah, we can take questions at the end. If folks want to put questions in the chat as we go along, that might be a good way to kind of store some up for the end. But yeah, why don't we push through to the end and with the presentation, and we'll take questions at the end.
Okay. So in terms of our deliverables of what we did with the Healthcare Equity Committee, identifying training and education partners. So we partnered with YW Boston, and they, actually I have a, yeah, we partnered with YW Boston. They've really been a leader since the early 80s on doing diversity, equity, inclusion training. Really excited about this. So it's the training will be in 3 formats or 3 fronts. And I actually, I'm getting ahead of myself. There's this next slide. I'll show you what that looks like. But it'll talk about YW Boston. We did do a system-wide survey through Gallup. So it was, we surveyed all of our colleagues and asked them specific questions. And I have the questions for you to review if you want at towards the end of the presentation. So we did that. And we also developed sub-teams. So I was getting a flood of emails of folks who are interested in going into this, seeing this presentation or this speaker, or have I heard about this book, or so on. So we actually came up with several sub-teams to help us kind of like get people's creative juices going, and also just to organize the work. So one of the teams that we identified was a group to look for speakers to come to our organization. So we have a speaker series. We had a group dedicated to online training and education. We had a group to look at books and media that could be brought into the organization and have discussion. We also had a group that looked into grants and funding opportunities that are out there that we can use to help, pay for these initiatives, and also do other community, also help fund other outreach activities. And then the 5th one was an analytics group. So finding the data nerds across the organization who are interested in looking at this and pulling out our data and really understanding, the way how we treat our patients. Is it equitable, and looking at the real hard numbers behind that. And then really just after doing all that was just creating a structure. Now we meet monthly. We have a steering committee, and we actually will be presenting to the board at the end of the month. It's really, really important. Can't emphasize it enough that you have board support and leadership, senior leadership support. Like I said before, Rosie Pietro was super supportive, but now Dr. Alan Smith is really equally committed. And so that's very gratifying. And the board has really signaled their support. And so that's I feel like we're off on a good, moving on a good, off on a good start with that. So, and this is our timeline of how we're trying to get things done. So we're pretty much ambitious in terms of because this is all during COVID. So trying to get all this stuff, and we have all of our other works going, but I was really impressed with how people were committed and just trying to keep people engaged throughout the process. We did experience a little bit of survey fatigue when we administered the survey in October. But I'll talk about that in a moment. But overall, I was really pleased with us getting this launched. So we anticipate having our training with YW Boston to begin in probably late January, early February. So with YW Boston, there's 3 pieces they look at for training with us. The first one is organizational change, which is a focus on senior leadership and the board, really understanding everyone, making sure we're all on the same page with definitions and principles and things that we want to impart or guide the organization with. And all these trainings usually would be in person, but they're all now remote. So it's a 2-hour training, so we're scheduling that. The second phase is understanding social identity. So this is a wider spread training. There's 5 there are 5 groups of 50 potentially. These are for managers and other leaders and above. And so we're really trying to spread this out. And this is talking about, it deals with topics like implicit bias and institutional racism and so on and so forth. I don't have all the full details on that, but what I'm excited about this is the wider spread, so we'll get a lot more of our leadership involved in that. And then the last piece is Inclusion Boston, which is something you can find out on their website, but really in layman's terms, for my terms of understanding, it's really the folks who are going to be the influencers, the people ultimately that we train, about 25 folks. They'll have like 5 sessions of training, about 10 hours of training. And these will be the people who will ultimately help us keep running the programs and keeping the organization engaged in these efforts. And so that's the three-piece approach that we have at YW Boston. The second piece I mentioned before was the Gallup survey. So we did the Gallup survey in October. We had it open for about a month. We had a 41% response rate, which we're hoping for it to be a little bit higher, but we had about, I'm not exaggerating, like 3 or 4 other surveys going on at the same time. So the fact that we had 41% wasn't too bad. The Gallup survey questions here. We asked questions such as, at work, I feel comfortable being myself. Diversity and inclusiveness issues are openly discussed. My company treasures diverse opinions and ideas. I am comfortable talking about background, cultural experience with my colleagues. The fifth one was very interesting. Everyone at this company is treated fairly regardless of ethnic background, gender, age, disability, or other differences not related to job performance. Number 6 was, I have the same opportunities for advancement. 7 is, what day-to-day operations, policy, or change can we do right now to support diversity and inclusion? And then 8 was, use 3 adjectives to describe South Shore Health as a place to work. So, and a lot of these questions we created some, but we got a lot of them from Gallup because they've done this with other organizations that they work with, and so they allow us to benchmark ourselves with other places. We just got like the final report from them, and still sort of I just submitted it to the steering committee. So we have to really kind of sift out what we learned from this, but it was an interesting experience to go through, and we probably will be surveying later on. But what it does is allow us a launching point for our training that we'll do beginning in February. And then our committee work. So this has been really gratifying to see people just kind of dive into it. So the speaker series group had already identified 4 or 5 speakers to bring to the organization. We actually have one coming on the 21st. Hopefully this link will work for you guys. Yes, perfect. Okay, so we have one coming on January 21st, and it is a psychiatrist, Dr. Christine Crawford, to talk about the impact of racism and trauma on Black mental health. If you're interested, I think we can share the link with people who are affiliated with the organization, so we can try to, if you want to be part or hear the conversation. It really is, this first wave of speaker series, or at least this first one, was intended mostly for just the community, but we can probably make arrangements to get other folks access if you're interested in learning, being part of this speaker series. We're really excited with this one. So this is our first one that we have, and there are CME credits associated with it too. And the other things that our groups have done, they're looking into developing a healthcare equity pledge for the organization. There's already talk of, they've already identified several books for organization to review, like the incredible story of Henrietta Lacks. I think many of you probably read that or know that story of the HeLa cells. Having a discussion on that, and then just having, just basically having those type of activities done. Data analytics review list. So the data team, which I help lead, we've already identified different projects that we're interested in setting up and doing some deep dive, understanding, for example, the percent makeup of our employee population versus the population we serve, and what's the discrepancy in that, and why is that. And then also we developed a SharePoint site for members for the entire organization to post questions, to get our materials, to kind of just be out there for people. So, and never a small thing to do, we even have a website, an email that people can drop questions and reach out to us. So that's where we are. I mean, it's been about 5-6 months worth of work. I think we've got quite a bit done, and there's more to come on this for the organization. So one thing I did say to Rose and Dr. Smith is that this isn't a one and done type of thing. We may do the training and then we just walk away. I think we just need to really figure out how we resource this permanently in the organization and make this part of our DNA of what we do. And so there's more to come on that. But that's all I have. So if there are any questions, happy to hear.
Great, thank you so much. I'm actually, all right. Sorry, I was on 2 devices at once. That's why we had feedback. I wanted to post that link to the article about the new health equity advisor to the transition team. So folks can take a look at that. I actually had a question. You talked about the data, about the data nerds coming together and trying to get some information. What's the, are there any early reports back on that, or any timeline on when you'll have more data to work with?
So I think one of the things that we've identified is that there are certain things you can get out of our electronic health records, EPIC, and also from our other population health-based system, Arcadia. And but I think what we need to do and what we identified is merging, let's say, race and ethnicity data with, let's say, outcomes on mortality rates or outcomes on readmissions, heart failure, pneumonia rates, that kind of thing. So I think we haven't really done that as much. So I think that is still ongoing. We're still developing those reports and making those clear to see. But really right now with the data committee, we're looking to try to sponsor specific research efforts because we want to formalize the look. So there isn't a timeline yet. At first, my idea with it was just to have people come in and post. I want to make it separate from what I do, which is I'm doing the data reporting to the state and to the feds, whatever, and we are being required now to show, let's say, for example, our COVID numbers and break it down by race and ethnicity. But that's what we have to do. What I'm trying to get folks in the organization to get excited about is looking and asking other questions that they want to look into as well. So those are 2 separate. But in terms of the things like I mentioned, like COVID, we are reporting those. So we have that by race and ethnicity. I think now the net is starting to widen in terms of like how do we apply those differentiation for other quality and safety metrics. So that's still in process. Does that make sense?
Yeah, it definitely does. I know that the state, at some point, they made an effort to collect racial and ethnic data on COVID, and I'm sure that's something that we'll be seeing more of. I know there's been some studies and stuff released about outcomes on the a breakdown on the outcomes. So I think it's so important to have the data because.
Yeah, we have a lot of that, and we are basically trending with the nation on that. We do see, for African Americans who come in, they have, higher rates. It is interesting to see. So I think really the challenge is getting people to just ask and look at it, because it's there, it's in front of us, but we can get caught up with other stuff. So I think really getting through that discipline of asking those questions is going to be key. And plus now the state's requiring it, so we have to. So it's good. So that's good.
Kathleen, you had a question?
Yes, good morning. Ben, this has been a terrific presentation. And I mean, I'm sure everybody here would agree that it's most unfortunate that it took the whole Black Lives Matter events to kind of move this rock. And so I really am very interested because, this has had such a long time, hard time starting nationwide. What could you tell us more about what the employee training will look like?
Yeah, so I actually have a few initial meetings with YW Boston to talk about what they're looking at. But one of the topics, for example, is look at implicit bias and understanding. So let me take one step back. So the training that we'll have with YW Boston is 2 fronts. One of it is, I'd say 80% of it is employee-employee interaction. And the other 20% is really talking about how providers work with patients in the community. Going to the employee-employee interaction, some of the topics that we'll look at is implicit bias. So what sort of preconceived notions do people have when we work with one another? And I know there are exercises and discussions that we'll have. I know that's a major piece of it. I think there are other items, and I don't have the full list at the moment. I think what I'm anticipating, what I'm looking forward to is just having these discussions, and the fact that we can spread it out to at least 250 colleagues is going to be really, really great. There's this notion in the hospital that, you know, there is no issue here. You know, you see a lot of comments from the Gallup survey was like, I don't see what the big deal is. And then you have other comments like, oh, this is a really, you know, biased organization. You hear the whole gamut. So I think really it'll be interesting to have some of these dialogue there. And, you know, the fact of the matter is that South Shore Hospital is, you know, not a, is not as diverse as like Boston Medical Center, you know, and it doesn't, when you look at the people that are working and the patients coming in, it doesn't necessarily reflect what you see in Wayman or in the South Shore. And one of our board members pointed out a great issue that if you're in Quincy, you're more likely to go over to Tufts or go into the city than you are to South Shore, and that's your local hospital. You know, why is that? So we have a ways to go, and I think having those discussions will be helpful to have for us.
Good luck.
Yeah, I applaud South Shore for taking this step and taking a look inward, really, to because it's so important for any organization, including our own CHNA, to look at how we're operating, how we're making sure that voices, a diverse voice is being heard. We're being more inclusive to the people of the community, all the people in the community. Mm-hmm. So that's something we've done on a much more limited basis as a CHNA, but that's why I think it's so important to have you here today to talk about what you're doing and maybe even think about how we can apply it to our work, whether our separate organizations or the CHNA itself. So,
sure.
Thank you.
Hi, I have a question. This is Tyra, and I'm so sorry. I'm having major technical difficulties this morning. And Ben, so I apologize if I missed it. But once, I know that you're looking at ways to identify certain issues, but once they have been identified, what is going to be done to hopefully correct them or improve them? So based on an employee-to-employee relationship or employee-patient relationship, if there have been things identified, what's the plan to correct those measures? Because it's not just enough to identify things, but what are you going to do to make sure that they don't happen or correct them?
Yeah, Tyra, that's a great question. You know, I'll be honest with you, I don't know. We haven't developed, I don't know what the process will be. We have a new senior VP of HR who just came on board. And so it's one thing for me to have a discussion with. I think it's, it is humbling to hear all the stories. I mean, there are stories. And so it is, I think it's how we vet them with senior leadership and then getting back to the person who posted the issue and then really figuring out how you have the resolution process. I honestly don't know. You know, not to make excuses, but being the VP of quality, I don't, you know, pretend to be a diversity inclusion expert. I think this is like, this is a question of like, how does HR manage these very sensitive issues and bringing them to we want to encourage people to have discussion and to bring it forward. And I've already experienced some interesting pushback when we start poking around on data questions, and some with feelings like, well, why are you asking that? There's no bias in what we do here. I'm like, you can't, but we have to be able to ask the question. You know what I mean? And so people, it's very touchy. So I don't know at the moment. I think this is something I'm looking forward to having a discussion with our president and with our HR folks on how we adjudicate it, because there definitely are stories. So I personally don't want to have any of these go away. You know what I mean? I want to be able to follow up because there are some real concerns. And I know we're no different than any other organization, but it's really, we have to be committed to a process. And I think the fact that we started this, that we're working inward and we're actually doing this is a good first step, because so often we could just ignore and just focus on the margin and focus on all the other stuff. And the fact that we're doing it in the middle of COVID still is, to me, is a testament that we are taking it seriously.
Okay, and just to follow up. Major feedback. So just to follow up with that, it would be, I strongly encourage to figure out that piece of things, because I have, as an African-American woman, it becomes, it's not enough to just have statistics. It's not enough to just ask questions, because if there's no resolution and no plan for resolution, if you just want to know what I'm going through, but not to ask me to listen with giving me hope that things are going to change, then it's no point of having a conversation. And I think that has been the sentiment across America and with the Black Lives Movement. Not just, okay, we see that things are happening, but no, what are you going to do about it? So even as an organization, even if there are small steps, please just make a plan to make something happen, something change.
Absolutely. Absolutely.
It's not fair to people to bring up these issues to say, well, I don't know what's going to happen from this. Because
I'm just people. From the standpoint of like how we're designing it at the moment, but yeah, I think the work we're doing with you is about resolution. So no, I
have it from my own experience. Yeah, and I'm just saying,
Oh no, I get you too. I'm African American myself. I get it. So I get it. So yeah, I get it. Yeah, I get it.
Awesome, thank you. Great question. Oh, Tyra. Oh,
I was just saying thank you.
Oh, okay. Yeah, thanks for the question. I'd be interested to hear how, if anyone can talk about their own organization and how other organizations maybe are addressing this. Certainly, this is something that everyone is looking at with a fresh perspective, I guess, as you referred to, Ben, because of the events of last summer and what we're seeing with health outcomes from COVID. But it also, this isn't something new. I mean, that's important to note too. We've seen health disparities across any number of different illnesses and diseases. And so it is important to recognize that this isn't something that just happened on June 5th or May 30th, whatever the date was. This is something that's been going on for a while.
Mike, this is Deb from BID Plymouth.
Yep.
Just wanted to let you know the system, Beth Israel Lahey Health, is also, they put together a committee to address these issues as well. And I'm so excited that this is finally being addressed, and that I would assume almost every hospital is looking at this, and it's about time. I don't know all the details, but I can tell you that they have a very robust plan from what I've heard, and it includes all of the hospitals that are under the Beth Israel Lahey Health family. So wish I had more to share, but hopefully soon to come.
Yeah, we'd love to hear more in the future about that, Deb. And I also, Tina Dwyer's on this call. I'm going to make sure we get the names of all those speakers that Ben's bringing in, because we want to make sure we maybe have an opportunity to bring some of their knowledge and expertise down to us here in the Plymouth Chinar area. Ben, just one maybe sort of a point. YW Boston, is that the YWCA of Boston?
Yes.
Okay.
Yeah.
That's what I thought, because I know down in New Bedford, the South Coast or I can't remember, Southeastern Mass, I guess, YWCA is doing a lot of work around health disparities in that region. So they've really taken the leadership down in that area. So it's great to hear that they're doing this on a more comprehensive basis as well.
Absolutely.
So does anyone else have any questions, comments, thoughts? I don't see anyone. Just scrolling through here. Ben, thank you so much. We really appreciate you taking the time and sharing with us what you're doing at South Shore Health. And I think we have the slides available, and Kim will most likely be sending those out as part of our follow-up to the meeting. so folks will be able to refer back to that. So thank you so much, Ben. We really appreciate you taking the time.
Oh, you're welcome. Take care. Have a good day, everyone.
Thank you, you too.
Happy New Year.
And Kathleen, I know you put in the chat an announcement. You want to talk a little bit about that? And if anyone else has announcements, feel free to unmute yourself.
Yes, hi, everybody. I did put in the chat my email address. The volunteers from, I think my grammar wasn't so good in the message that I put in the chat. The volunteers from NAMI Plymouth area, together with volunteers from the DMH Plymouth Site Board, a small group, have put together a roadmap through the mental health system in Massachusetts for 2021. And we got a generous grant from South Shore Partners, South Shore Community Partners in Prevention, yay, to have it printed. And we're able to send out hard copies right now until our supply is exhausted. And we want to strike while the iron is hot. These things, you know, don't last forever. The information is up to the minute and accurate, and eventually, you know, it won't be that way. So please email me, Kathleen Considine 535@gmail.com, and I will send you out this afternoon a hard copy of our roadmap. But it has to be your street address. We'll send it. Most of you are working remotely. We'll send it to your home. And I hope that you find it useful and you're able to pass it on. And if you need more copies, just let us know. Thank you, Mike.
Awesome. Thanks, Kathleen. And I did get my copy in the Plymouth office.
Oh,
It
good.
came at some point. It was there yesterday when I went in the office. So thank you.
Okay.
Does anyone else have an announcement? Kim, I don't know if you want to talk about the breakfast next Friday.
Sure, thanks, Mike. Many of you hopefully have gotten the invitation, but typically we have our annual joint legislative breakfast that we host in partnership with United Way and our partner agencies, Community Services of Greater Brockton and the Greater Plymouth Council of Human Service Agencies. And this year we are of course going virtual, but we set up a really great panel in the morning with our legislators, and then we're going to do an agency highlight with a virtual slideshow to showcase the excellent work of many of the folks like you all on the call. And then we'll have some breakout rooms to have smaller conversations about priorities with basically the theme of rebuilding and reimagining beyond COVID. So how we can all work together and how we can advocate in partnership with our legislators. So that is next Friday, January 22nd. I'll pop the link in the chat. It's at 9 a.m. We'll go until about 10:30. Totally free to join. It's still plenty of room to register. It'll be held on Zoom. So thank you, Mike, for the plug. All are welcome. We'd love to have a nice full room with some great conversations that morning.
Great. Thank you. Katie, I know you're going to leave. Thank you for your presentation. I'm going to check out the Resiliency Library. We'll urge everyone to do that. And does anyone else have an announcement to make?
I do. Good morning, everyone. My name is Brittany Badgett. This is my first time being able to attend this meeting with you all. I work for Health and Pairs. I'm the Youth and Community Services Manager, and I do several things there. But the announcement that I wanted to bring up, we recently got a grant in conjunction with the Department of Justice to help combat human trafficking in Plymouth County. And so that's something that we're super, super excited about. And so I oversee our human trafficking unit within our organization. And we have an event coming up in conjunction with Massasoit and the DOJ, in which we are going to be hosting a Human Trafficking Awareness Day, as January is Human Trafficking Awareness Month. And so that's going to be on January the 27th from 11:45 a.m. to 1 p.m., of course, via Zoom. So if anyone is interested in having any more information about that or potentially attending that event, please reach out. I'll put my information in the chat and you can send me an email and I can make sure that you guys get that flyer and you're able to attend. So yeah, thank you.
That's great. Thank you, Brittany. Yeah, if you could put that in the chat, and even if you can email it to us at chna23@gmail.com. That way we can make sure that Kim can email it out to everyone as well. So that's great. Thank you so much. Thanks for being here. Welcome. Any other announcements?
Mike?
Yes,
Hi, Mick.
Nancy?
It's Nancy from Health Imperatives, Plymouth Sexual and Reproductive Health. I just want to remind folks that we are now offering Narcan at our clinic through Plymouth Heal Coalition. We screen our patients for substance use disorder, but we're also offering it to them as well as if they have someone in their life that is afflicted and they need just to have it. So, let us know if you have a need, if any of your clients have a need. We're really happy to help get that distributed.
Great.
Thanks.
Thank you. And I just put in the chat the email chna23@gmail.com. If you have any flyers or notices, the good old days of flyers and hard copies and pieces of paper to share. But if you want to send that to Kim, and we'd be happy to send that out to everyone on our list. We have a pretty good size distribution list, and it's always great to, as I said at the beginning, network and share resources. So any other announcements? Oh, the Facebook page, yep. Facebook.com/CHNA23.
Just another option.
Yeah. And also a good reminder that Kim has been posting videos from our health fair, which was held in October on a regular basis. So there's a lot of great resources on there. We did a virtual health fair, as many people know, and we had video presentations by a bunch of different groups and agencies in the region about their work. So that might be something you want to take a look at, because there might be things on there you don't know about different groups. So do check out our Facebook page, and it's on our website as well. Any other announcements? If not, I will just thank you all for being here. Our next date is February 10th, which is a Wednesday. Same bat time, same bat channel. Well, different bat channel, I guess, because the Zoom channel never stays the same. But we are hoping to talk about vaccines. I think that we're getting a lot of questions. I know in our office, we get calls every day about when am I going to be able to get the vaccine? So hopefully we hope to have speakers who can talk a little bit more about that on the local and state level. And that is what we're planning for Wednesday, February 10th. So we hope you all can join us. And I wish everyone a good day and enjoy the rest of January.